All right. Welcome, everybody, to the Biodesign's Building for Digital Health Cardinal Kit Buildathon. My name is Oliver Lamy. I'm a vascular surgeon and the director of Biodesign for Digital Health here at Stanford University. I want to start off by thanking everyone for joining today's inaugural event. hosted in partnership with Stanford SHIFT Student Healthcare Club. So I want to start off also by recognizing that these have been incredibly challenging times with COVID-19, all the racial injustices, and now wildfires raging through California and Oregon. They've definitely been difficult times. But as a group, we believe in the power of respect, diversity, and inclusion. And we want to make it very clear that any cyberbullying, harassment, or hateful, abusive, or violent speech will not be tolerated during this event. And really, we're here to make the world a better place. So I'm just going to go over some quick housekeeping topics. Most all communication for this event will happen over Discord. So hopefully if you received your Discord invitation and gone through the steps to get access to all the channels. All the content can be, for the streamed events will either be on Google Meet, but also on Biodesign's YouTube channel, streamed via YouTube Live. And feel free to ask questions in the chat sections. We'll have people monitoring those channels, and hopefully, and they'll pass on the questions, and we can ask some questions or answer your questions. Just a quick overview of the schedule. Today's probably the longest day of just talks and so on. We're going to have a quick kickoff, a few talks. We'll have an introduction to digital health and Cardinal Kit. We're going to have the Apple Health team as well as the Google Cloud team talk about some really exciting features, some team formation, happy hour, and then you'll be able to build your Cardinal Kit sample app as your foundation for your project. And then we'll have office hours through the night. And then tomorrow we're going to repeat for the folks in the off time zones or the different time zones. They're going to be able to repeat and watch the presentations, and we'll continue to have workshops and office hours the rest of day 2, and then also day 3 prior to submission, which is at 1 p.m. This Sunday before the judging and the closing ceremony. So, why are we here today? Healthcare is one of the largest industries in the United States, but I think, we also have to always remember, when you look from the outside, it's hard to realize, but it's also very, very personal. It's one of the most personal industries. And that's one of the things that makes it so challenging in the face of our digital health revolution. There's so many opportunities to deliver healthcare better, more personal, and less expensive. And the data that we need to do this with, however, is very, very personal, and therefore private. When I caught the digital health bug over 10 years ago and started developing healthcare products, I quickly learned that building healthcare is not the same as building normal consumer products. Again, because it is so regulated and so private and so personal. We've all heard of HIPAA, or maybe you haven't heard of HIPAA, but it's the Health Insurance Portability and Accountability Act. And, this space is regulated. And for this reason, the implementation of digital health applications is very, very specific and can provide several hurdles and obstacles. And one of the big things, or one of the big points of this rule, what it focuses on, is the protection of what is called protected health information, or PHI. This is just one example. So there are 18 identifiers, for example. You think of all your regular applications, but if anything related to PHI, which could be a name, a fax number, a phone number, dates of procedures, social security numbers, account numbers, health insurance numbers, or any sort of biometric identifiers, this is all considered protected health information and needs to be protected and addressed and handled in a very specific manner. And it's always very challenging. How do you, as someone who's not used to, working in healthcare, how do you get around these rules and regulations? It's really hard to wrap your head around it. And part of the reason is that it's not one person's responsibility. whenever you're deploying something like this. There's this concept called the shared responsibility model, or it's basically shared responsibility between, the developers and all the partners, any health systems you work with, and so on. And this is just an example of a shared responsibility matrix. If you're using the CardinalKit framework, you're going to use, we're using Google Cloud Platform. So, in partnership with Google Cloud, they have their responsibilities that they agree to. It is our job to make sure to get what's called a business associate agreement. You see that under the developer side for the team to handle. It's our job to, configure the Google Cloud Platform to follow certain security rules, to implement two-factor authentication and so on. But obviously, we can't manage the data center or the data encryption on the server side as or be responsible for any sort of breach notification on the server side. So again, it's a shared model. And one of the reasons we came up or wanted to implement CardinalKit as a framework is just to make it easier in making your choices and selection. Here at Stanford, we have a third partner, the university. So if we were to deploy a research application, the university is going to handle a few things. They want to basically run everything on their instance of the server back end. We still build the front end, so that's something that CardinalKit framework could help manage. But the developers still have the responsibility, as you can see in this matrix. So, you can imagine it's, being very passionate in sort of a space. It can be a long road to get from a digital health concept to reality. And so we, a group of researchers, digital health researchers here at the university got together, and we're very interested in figuring out how we could lower the barrier and share our kind of combined knowledge of this. And basically taught a course, a Biodesign course, CS 342, last fall. And that's basically when CardinalKit came to life. And so our goal really with this conference and with this Buildathon is, again, to share our knowledge, develop better tools, to realize the impact of all the great healthcare solutions that they could have. So, but this is all under the umbrella of Biodesign, as the founder of Biodesign himself always says, that a well-characterized need is the DNA of a great invention. And so one of the big focuses for each of the groups is and challenges will be, whatever area you work on, to really define your area of need and come up with a need statement. And we have a lot of material to help you guide your team through that process. And we have the honor of having Paul Yock here today to speak a little bit about Biodesign and digital health.
Hi, Oliver. Can you hear me okay?
I can. Yeah. Hi, Paul.
Great. Well, let me add my welcome to everyone in the Buildathon. Oliver and his team has put a huge amount of work into the preparation for this event. It's going to be fun and fascinating to see how the next few days play out. So at Biodesign, we're hugely excited about the development of digital health. From our standpoint as more medical gizmologists, the digital approaches give a tremendous opportunity to monitor health, to anticipate disease, to measure recovery in a lot more precise and powerful way than it's been true in the past. That's clear. Another thing that I've come to appreciate is that the digital approaches give us potentially important leverage on what I think is the trickiest aspect of healthcare, namely people's compliance with healthy behaviors and with treatment. So I just want to take 1 minute to provide a little bit of framing from the standpoint of our innovation approach to biodesign. Oliver alluded to the fact that we have a needs-based approach, and I would say what we've seen in digital health as it's evolved over the last few years is really a collision of two kinds of approaches to innovation. In medtech, and that's been historically focused on medical devices, we've understood through a series of really painful experiences that the user landscape for our technologies is really complicated. That there's this vast array of stakeholders, and you really have to take special time and special effort to investigate that set of stakeholders. And it's only in our training process, it's only after we have a deep understanding of that need matrix that we even try to invent a solution. In the early days of digital health, there was a lot of enthusiasm for a faster, easier innovation process based on the notion that, you know, if you came up with a good idea, you could rapidly test it with a digital MVP, and then you were off to the races. And as you all know, on this meeting, those early races, I guess, had a lot of roadkill, to stay with the metaphor. So we're at a stage now where there is a nice hybrid emerging of these two innovation processes. We know now that it's very much worth the time and effort to come to a deep understanding of the need, the lesson we've learned from medtech. But on the digital health side, the speed of testing of the different stakeholders, groups, testing of the concepts can be an order of magnitude or more faster, less expensive, more definitive than has been true historically in medtech. And these are approaches we've borrowed from the tech innovation process. So as you're starting to launch your projects, a quick check for you that we would use in any of our classes. So our core test with our trainees of whether they have the right DNA to go forward with a project is pretty simple. And that is, can you describe the goal for your project in the form of a single need statement? This is just one sentence that describes, first, what's the problem you're trying to solve? Second, what's the specific population who you're solving for? And then third, what is the outcome, the specific outcome that will be important enough for somebody to pay for your technology? So if you have those three things straight, the right problem, the right population, and the right outcome, you're ready to launch. So with that, I'll hand it back over to Oliver, just with best wishes for a highly productive and enjoyable next few days. Thanks a lot. Oliver, are you muted?
Oh yeah, that was fantastic. Thank you very much for that great explanation. So next, you know, we've kind of learned a little bit about, you know, innovating or identifying the need. Another huge challenge, especially in the academic setting, is, you know, having that third partner. We talked about the university partner, and Michael Halas, we have the honor of having him join us today. He's the Deputy CIO of Stanford HealthKit, the School of Medicine, and Associate Dean for Industry Relations and Digital Solutions. And he's in charge of, you know, it's a very difficult challenge, you know, with all these amazing digital health opportunities and studies. How do we best implement them, and how do we do it safely? Because, you know, again, this is a very private, whenever you're dealing with digital health, you're dealing with very personal, private information. And this is a real big challenge. And so, Michael, I don't know if you're on.
I'm here, yeah. Can you hear me?
You're very quiet. Can barely hear you.
Let me see if I can change that.
You're very muted, or very quiet. I mean, I can barely hear you. I think it may be a mic issue. For me, it's very quiet. How's it for everyone else?
I'm getting the same
better.
thing.
Yeah, but it was better than before. So maybe crank it up just a bit more.
Yeah, I think it's cranked up about as high as it can go. If I lean in closer, is that any better?
It's really muted. Can barely hear you. Maybe what if while you do some troubleshooting, is Topher on? Maybe while Mike is troubleshooting.
Oliver, I'm here.
Topher's there. So Mike, we're gonna just, while you're troubleshooting, I'm gonna move ahead. We were gonna talk about the university research side, and we're also very fortunate to have Dr. Topher Sharp, who's a professor of medicine and also the CMIO, or Chief Medical Information Officer. So he's charged not with research as well, but more primarily clinical care, patient care. So let's say you come up with a great solution and you want to get it implemented, and now you have to go through the hospital process of and the procedures involved to get whatever solution approved. And there are many challenges, again, because you're dealing with very private personal information. So we're lucky to have Topher kind of just give us a few minute overview of what that looks like and what the trends have been.
Hey, thanks, Oliver. Great. Please, I hope you can hear me, and good to go. Great. Thank you. So, yeah, my name is Oliver Smith, and I'm a practicing clinician, but I also serve in this interesting role where I'm basically responsible as a clinician to make sure that we have health information technologies that really serve our clinicians so they can serve their patients. And at the same time, I also have an accountability to make sure that the things we have are things we can really use. I need to make sure that our clinicians know how to and feel good about using the things that they have in order to accomplish their needs in terms of their care delivery. So when you start to think about novel innovations, I just want to set that stage, which is, gosh, first we have to figure out how those novel innovations come in on a technical basis into our environment. But then the second part of it is we really have to figure out how they come into our operational flow, how they actually fit our needs to be able to meet the needs of our patients. So, and I'm not, I don't lead our technical team. I'm is it coming through now? Any better?
Oh, that's way better. Way better.
Okay, hey, great. Thanks for the feedback. In the setting then, let me just talk a little bit about the needs around bringing digital health into a care environment. So, as all of you know, COVID has just propelled and changed the whole paradigm about how we can deliver healthcare. Not only have we moved a lot of clinicians who are uncomfortable initially to say, gosh, I have a way that I interact with patients. You can bring the patient to me, bring the problem to me, and I will help you solve it. Not only have our clinicians changed their tune about this, but obviously patients who in the past have said, no, my preference is to maintain more of a stable relationship. My preference is to come to your center, have really changed their tune as well, and have realized that there are big advantages to alternate types of solutions there. And so what I guess I would say around this for you all to think about is that there are lots of ways in which digital health solutions are becoming more and more important in care delivery, and really that end of the line when you get all the way into hospital or clinic-based care. And so where we used to see digital health solutions often more propelled around wellness or other kind of direct management, now we're seeing that we really need to connect all the way through. But the key part of this that we really focus on is we need to solve the right problems. So there are challenges around interoperability and how you connect these things, challenges about how you actually bring them into the workflow. But one of the key challenges is, are we really solving the right problems? And I just want to share the problems that are motivating us lately, which number one is safety. In the setting of COVID, healthcare, which we all knew had some risks, now has all new ones. We've got to be really thoughtful about what safety looks like for not only our patients, but also our caregivers. The second one is access, which is COVID closed our doors. We need to open our doors. We need to figure out how that works. And even if that means opening out digitally, extending out, finding other ways to go out to reach out into a patient's need. And the third is what I'll call new economics, because we all know that things grossly changed in the economics thing of both our country and our healthcare delivery. So our healthcare system, like all healthcare systems, is under economic duress. Our communities are under economic duress, and our patients are under economic duress. So that means that now, when we think about solutions that matter, we really need to make sure the solutions are pointed at these key problems. So I'd say, we're trying to find ways where digital health really helps. Virtual visits for us went from video visits went from less than 2% of overall ambulatory care to more than 70% of our ambulatory visits in the wake of COVID, and now are starting to level out in some places actually makes a balance out of that. Remote patient monitoring, which was previously seen as something that would be of interest, is now something that will be an imperative for certain populations. An example might be an immunosuppressed cancer patient. We don't want them to come in to get their checks. We want to bring the checks to them in a way that keeps them safe in their homes, still gives them access to the care they need, and then meets of needs around these new economics to be viable. So those are the things I share with you that we're really thinking about as a health system, trying to make sure that the new innovations that you would be thinking about bringing up and bringing forward can start to really fit back into our care delivery. Thanks, Paul.
Yeah, that was fantastic. Thank you so much for that.
Oliver, you're muted.
Oh, okay, that's why. Okay, so thank you, Topher. I really appreciate it. It's really incredible how, some people are saying COVID has advanced us by 5 years in terms of the digital health transformations that had been on the roadmap and that people had predicted. But that was really insightful. I don't know, Mike, are you on? Is your audio working?
Yeah, so can you hear me now? I called in my phone.
Much better, thank you.
Oh yeah, that's much better. Dr. Hello?
Okay, good.
Perfect. Yeah, so I really thank you for joining as well and speaking as well as to the the challenges, where we are, where we're going, from the university side in digital health.
Yeah, great. Well, thanks for having me, Oliver, and thanks to everybody who's attending. I think this event is wonderful. I'm so glad to see it happen. I think, as Paul Yock had said, and Oliver, the potential for the ability to use Cardinal Kits, wearables, and sensors to advance health is absolutely tremendous, and we're very, very early on in that pursuit. So there's amazing untapped potential, and it's people like you who are going to get us there. So I'm really excited for this. And in my role here at Stanford, one of the things that I love about it is that I really have a front row seat as these technologies emerge and as really smart people start to tackle interesting problems using the mobile health space. And it is all over the map, which is really great to see. And, it's everything from starting to understand health better. The incredible ability to have 24/7 sensors on people and a health device in their pocket or in their hands and all around their homes really provides insights into health in ways that we've never had before, and opportunities to change behavior and develop new kinds of interventions. So it is really exciting. And as Oliver said, there really is this important link. If you're working on behalf of a health system or a university, particularly here at Stanford, the partnership with that institution is very important. And here at Stanford, we make every effort we can to facilitate things, move them forward efficiently, build the kind of infrastructure that can help, which is why I think CardinalKit is really amazing. And things can get a little bit complicated in ways that are unpredictable, even for technology-savvy people such as yourselves. It just has one simple, well, not simple, but one interesting example. We recently worked with Apple on the Apple Heart study, which worked to validate that the watch can detect AFib accurately. Ultimately, we ended up enrolling 400,000 people and streaming data, therefore, from 400,000 watches, which got very, very large very quickly. And the challenge of capturing all that data as it streams in a format that actually can be analyzed for insight just opens up all kinds of interesting questions and really helped us to move forward in the space in terms of how we manage data coming in from wearables. The additional challenge then for how you move data coming from wearables and sensors into healthcare and clinical workflow also provides all kinds of challenges, not only technical, and Topher was alluding to this too, but just the experience of the physicians and the patients as they already are surrounded by data and systems. So as you're building your apps, think through all the way, what kind of data is likely to be generated? Do I have to analyze it for science? Does it have to be repeatable science? Is this going to generate new kinds of data that maybe haven't been captured in this way before? And then your institution should be able to help you. And certainly here at Stanford, we want to help you with infrastructure that can move things forward. So, I think the other really important thing, and Oliver touched on this, is that, working with data about individual health, it's really a privilege to get to work with that kind of data. And it's a responsibility that has to be taken incredibly seriously, not only for the regulatory reasons, which are very important, things like HIPAA and GDPR. And with mobile apps, they can quickly go international. So you get into international law, which can get complicated. Those are all important. But there are a lot of nuances just on the social and personal level that also are important. I mean, people feel differently about their data. One thing that's sensitive to one person is not sensitive to another. I mean, COVID is a great example. So, we have many clinical trials going here at Stanford where we have all kinds of data about participants in those clinical trials. So we're testing a lot of people. So we know who's testing positive and who's not. We obviously keep that very secure. But imagine you test positive. How do you feel about that data? Is it very sensitive to you? It may be. It may not be sensitive to another person. So as you're building apps that collect and work with health data across a broad range of individuals, there are all kinds of factors that come into play that go beyond just the regulatory issues. And it can cause, kind of real distress for people about privacy and where it's going and how's it going to be handled and will it be disclosed and is it protected well? So again, that's where the institution really wants to partner with you and help you with that. And it may seem like sometimes the institution is throwing up barriers. I certainly hear that. We have all these requirements and requires security reviews, and there's certain controls that have to be in place, and we have to be involved to understand what it is. That may seem like barriers, but the way we look at it, the institution really is your protector, because these are serious issues when you're dealing with this kind of data. And not only is the institution at risk, but you personally can also be at risk depending on the circumstances. So, we have lived through this and seen this in many examples. And so, we develop these processes to really ensure the safety and rigor of what you guys are doing and the wonderful ideas that you have. So, we really do want to be a part of the equation. And I think every institution, as I talk to my peers across the country, it's the same there. So, I think that you will find a welcoming environment when you reach out, and we do want to partner. It is, it's an important endeavor with lots and lots of potential. So thank you, Oliver, for having me.
Yeah, let me make sure I'm not muted. Okay, I'm not muted. No, thank you. That was fantastic, Mike. I mean, we got now really good overview, from the researcher side, from the university side, from the hospital side. And it's far too exciting to not work in this space. So I really appreciate everyone participating, being involved. We were supposed to have an intermission, but we're probably going to skip it and go straight to a panel discussion on digital health trends. So you can either cue that up, or I know Amir is our DJ. That is approved, or the innovations they want to encourage need to meet what some call the triple aim, where that new innovation needs to not only have better outcomes, it needs to be able to provide it at a lower cost, and it needs to be scalable to a population. And that's exactly where digital health fits in really well. And one definition, our definition of Biodesign for digital health, it would be the convergence of data, connectivity, compute power, and the physician or the provider to increase access, in a more personalized way, and to improve outcomes at a lower cost. So the bottom line is, it all starts with the patient. The data is all coming from the patient, and whether it's through a mobile application, a device, wearable, sensor, hospital interaction, pharmacy interaction, and then that data then can be analyzed either through human analysis or computational analysis to provide some value in this feedback loop that you see back to the healthcare system. And this is what's really changed over the years. The issue with healthcare as well, though, we talked earlier about how it's definitely not a consumer. It's very different than a consumer market. You know, healthcare, some people call it an eight-headed monster. You know, you've got so many stakeholders that you need to meet. And it's one of the few areas where the the customer is not necessarily the person paying the bills, right? The patient isn't always paying the bills. It's the insurance company. So there's this disconnect in terms of incentives and how things are structured. You have government payer like CMS. You have private insurance companies like Blue Shield, Blue Cross, or United Healthcare. You have the regulatory folks like the FDA. And what's really cool about digital health is that you bring in the patient, you know, the patient at home. Now with connectivity, you can, you know, the patient becomes kind of a consumer of healthcare at home, and it brings that potential. And that's something I want everyone just to keep in the back of their minds. So, you know, one way to deal with this complexity is through the Biodesign process, and Dr. Yock mentioned the need statement and the power of having a well-defined need. So that's really important. We also touched on a lot of this. So I'll just go through this quickly. You know, we have the privacy security issues to deal with, reimbursement issues, things like that. But what's important to realize is that when the government noted that they're on an unsustainable trajectory, they also realized that they couldn't measure the outcomes. Nothing was digital. Back before 2009, a large portion of hospitals were still using paper-based systems. And so that's when the HITECH Act was passed to really incentivize healthcare systems to go digital. And they spent $31 billion in an incentive plan to encourage hospitals and so on to go digital and adopt electronic health records. And one of the really important additional requirements was that, you know, these hospitals needed to provide a way for patients to be able to view, download, and transmit their data. That's how it started in the early years. And most hospitals basically, you know, launched the patient portal, which I don't know if you've ever gone to your hospital or your clinic's portal, and you can make it a clinic appointment, renew your meds, things like that. But most of the data was still, you know, very much siloed within that healthcare system. And so the government kept adding these new rules. The one to follow in meaningful use stage 3 in 2015 was that in addition to the ability to view, download, and transmit health information, they brought in a requirement to have an API, an application programming interface, to be able to get at least, you know, 12, 13 elements from the healthcare record out. And that's something the patient should be able to have access to. And this is really what I want to highlight and what we should focus on. Because that really opens the door for the patient to be the steward of their own data. And I think this theme, as we go on, you'll hear is really, really important, because the hospitals aren't necessarily incentivized enough to release the data on their own. So there are some other things that healthcare did around reimbursement. They came up with what are called alternative payment programs, such as affordable accountable care organizations or Medicare Advantage plans. So it's a way for the health system to take on a little bit more risk for the care of the patient, rather than being a fee-for-service hospital. Most hospitals in the country are still very much fee-for-service, meaning, you know, they do great when they have a lot of heads in beds. They do great when the hospital is full. You know, the government was more interested in thinking, how can we incentivize a program to engage patients outside of the clinic, outside of the four walls of the hospital, to keep patients healthy and keep them out of the hospital. And in that same vein, they passed, realizing that, you know, telehealth is one of the ways that we could achieve this. There's the Chronic Care Act, which expanded telehealth reimbursement. In 2018, also, there was some patient-generated health data codes, reimbursement codes that came out to help reimburse physicians for reviewing data that was coming from patients, because you really have to think about reimbursement if the physician or provider doesn't get reimbursed for reviewing data, they'll just want the patient to come into the hospital to be seen. So there are also some regulatory things from the FDA to help treat software as a medical device, which is and the Apple the AFib notification, or the irregular rhythm notification from the Apple Watch, was one of these programs. As you know, with software, you need to update regularly, and you can't really expect a company to go through full FDA approval. So that's a big thing. Something I want to give some really so just to highlight, you are going to be, with all these rules, opening up these APIs and liberating the data. It's groups like you that'll really be the innovators for tomorrow and provide innovative solutions on top of the electronic health record. It won't be the electronic health record vendors. The one real example of actually, I only have a minute left, but one example of a very innovative health system is Ochsner Health System in New Orleans, and they're one of these alternative payment programs, or they belong to or are involved with one of these alternative payment programs called Medicare Advantage. So they get a big bucket of money at the beginning of the year, and if they do well taking care of their patients, they actually get to keep more of the money. And so they go all out in having all these remote monitoring programs to manage patients, such as the hypertension program, which has been quite effective at bringing patients' blood pressure down within weeks rather than months, by simply providing a patient with a subsidized blood pressure cuff and monitoring their blood pressure remotely, and then texting medication changes and so on a weekly basis. What's even more exciting is, the government hasn't stopped. Even in March of this year, there was an update, or the final rule of the 21st Century Cures Act, which stated that this API that initially only was exposing 13 elements will eventually expose basically all data elements within the EHR. You're going to hear a lot about interoperability, or the lack thereof. And the goal of this is to really liberate the data and give the patient the keys. And that's exactly how it works. The patient now has the right to ask for this data starting in 2021 if COVID doesn't change those timelines. So there's still quite a few hurdles to adoption, but I'm going to wrap up here real quick. We've already talked about COVID and how it's accelerated the digital transformation of progress. 5 years of progress has been made over 5 months. It's been quite remarkable. So we're in a really, really good place. I'm going to just end here and pass it on to Brandon, who was a Biodesign. He's a neurosurgery resident and was graduated from the Biodesign program as a fellow. And he's going to talk a little bit about the Biodesign process. Brandon, I'm going to stop sharing my screen.
Terrific. Thanks, Oliver.
Did that work?
Yep. I'm just pulling up the presentation here. And let me know if I need to swap displays, or are you seeing the correct one?
I see needs-based innovation for digital health. Yep, we're good.
Terrific. All right. Well, thanks, Oliver. And as Oliver mentioned, I'm Brandon McCutcheon, Biodesign Fellow from this past year. And one of the two things that we really hope that you take away from the Buildathon is not only CardinalKit, which we'll dive into a bit with Mike's talk next, but also this framework that we call a need statement. And the motivation for that is most of us do innovation this way just by our default. We love our toys, we love our technology, we're enamored with the cool widget that we can make. And so we quickly often think of, hey, can I build this cool thing? And then only after the fact go and try to find a use case for that need, or try to find a customer, or at the end of the day, really the unmet need. And all of us want to impact patient care. All of us want to launch successful products. And so really, this is motivating, because when we look at the reason that startups fail, the number one thing is that they did not identify the market need. And so there's this gap in product market fit. And so we really believe with the Biodesign process that if we can turn this on its head, and we can start with the unmet clinical need, define every aspect of that, understand its intricacies, we can then craft a technology, a solution that perfectly meets that need. And so rather than doing this technology push, we do a market pull. We have the market and the unmet clinical need guide us to where we need to go. And so Dr. Yakin mentioned the need statement earlier, and this is really the tool that we can use to make sure that we understand the need. And it's deceptively simple, but it's a basic framework, as Dr. Yakin had mentioned, that involves three things. And so what we do is we take the problem, the population, and the desired outcome, and we put it into a statement like you see on the screen here. And it's fairly formulaic, but it delivers a surprising amount of insight. And so when we're looking at the first of these pieces, the problem, what we want to do is ask ourselves to really understand that, see if we understand the problem in a unique way, see if we can look at it at a way that somebody else hasn't, and through there try to develop some insight. The problem often combined with the population is similar type of thinking. You can say, okay, how does this problem affect a specific subset of a given population? So often in a disease state, the patient population is somewhat heterogeneous. And so by looking at these different patient populations and understanding how a given need affects patients differently, we can really start to develop a unique understanding. And so then we combine the problem and the specific population with our desired outcome. And the important thing with the outcome is to really stop and ask, what outcome, if I could achieve it, would really drive adoption of and really allow me to solve this unmet need? And so again, this is critical, and it delivers really a deep and nuanced understanding of your problem space. It allows you to think about it in a different way, which is really the key to innovation, is having a unique insight or a competitive advantage, a differentiator that allows you to solve something in a way that no one else has before. And on the flip side of it, it's really the tool, the kind of self-restraint that we can impose on ourselves to make sure that we don't jump to developing solutions too quickly, or to going down the road of working on a project that we could have known from the beginning there were inevitable problems we'd find along the way, and only find those out too late. Most of us are going to invest years into the projects that we work on, and so we'd rather know these things up front than later on. So walking through a quick example, as innovators, we're often looking for inspiration in everyday aspects of our life. So imagine you're reading the New York Times and we're in the middle of a pandemic, but you say, hey, I noticed that opioid deaths are still really a problem, and we're in the middle of an opioid epidemic as well. And so you could take that and start to say, okay, well, what's the problem here? Well, we need to reduce opioid use. And then you say, okay, the population, it's in patients with pain. Those are patients who are using opioids. That makes sense. And then the outcome, okay, what would really impact, what would really drive adoption? What would get people to pay for a solution if I were able to develop it for this need? And let's say we start with decreasing the rate of the death rate associated with opioid use. Now, this is kind of illustrative, and there are a number of problems here that we'll iterate through. This is really not an insightful need statement. It's kind of a need statement that anybody who's reading the front of the New York Times could craft. And so the question is how do we dig in a little bit more deeply and find something more nuanced? And so we think about iterating on this need. We essentially need to get data. And I think one, you can do this by research. PubMed is a great source, and that's really one of our tools as medtech innovators. Is the published literature, going in and understanding, again, the opioid epidemic in a new way. There's a ton of publications out there. And then the other key piece of it that I think a lot of us are reticent to do, because it involves really putting ourselves out there, being vulnerable, asking questions, especially oftentimes of busy clinicians, is going out and talking to the stakeholders. These are oftentimes doctors, but they can be other providers, hospital administrators, or even patients themselves. And I think I would really challenge everybody over the course of the weekend. Obviously, things are going to move quickly, but see if you can't go talk to a patient or a provider. There's lots of people in the Discord channel who maybe would be able to provide you some unique insight. And so let's kind of see how this would play out. So let's say we want to learn more about the opioid epidemic. So we go and talk to a primary care physician. And that primary care physician, really laments, I really see these addictions starting after surgery. After patients undergo surgery, they're given painkillers, and it starts this whole vicious cycle. And they even suggest to you, hey, maybe orthopedic surgery is specifically a problem or a unique problem. So let's say, so you take that, you go to the literature, you can look that up and say, hey, yeah, really orthopedic surgery is associated with an increased risk of long-term addiction. You go talk to an orthopedic surgeon, and you start to kind of ask questions. What would they want to see, or how do they understand the problem, and what would really drive adoption for them of a solution? And they tell you, if you could show me hard data that you were able to reduce the chronic rate or the rate of conversion to chronic opioid abuse, that's a product I would love. That's a need that we really need to solve. And so you go into that and say, okay, look in the literature a bit more, and maybe you find something interesting like this that suggests if I can limit the duration of prescription after surgery, then science and studies have shown that really is associated with a reduced rate of chronic abuse. And so we kind of put this newer understanding together and frame the need statement maybe in a more nuanced way like this: a way to reduce the duration of opioid use after surgery in patients undergoing orthopedic surgery, so that specific population, in order to decrease the rate of conversion to chronic use. And this is something that Mike will walk through next in his presentation, but it's something that we're really proud of that the SMART team has been doing, has built on top of the Cardinal Kit framework. And so we'll get to that in a little bit. So again, in summary, the need statement is three things: identifying the problem, the population, the outcome. If one of the things, we'll put these slides in the Discord channel, and we'll also put a need characterization worksheet in there. This is another tool that can really help you walk through not only the problem, population, outcome, but some other key questions to ask about the unmet need that will really help you develop things going forward. All right, well, thank you for your attention, and I will turn it back over to Mike.
Great, thanks, Brandon, and thanks everyone for joining us today.
We can hear you, Mike, and now we can see your screen.
Okay.
We're good.
Okay, great. Thanks so much. My name is Mike Hittle. I'm a doctoral student at Stanford in epidemiology, also the co-founder of CardinalKit. So I want to just touch on CardinalKit, what motivated us to create CardinalKit, and what you can do with CardinalKit and what pain points it might solve for you. So here are the 6 basic ingredients of most digital health apps. First, we have informed consent. So this is kind of a terms of service analog derived from the IRB. So this is just ensuring that the people using your application kind of understand what risks might be involved and what will happen with the data that they provide. Then we have general surveys, instruments, some of them validated, some new instruments that you might be trying to validate, used to track health or observe the patient's reported involvement with a condition. Then we have activity, motion, and sensor capture. So this might be the Apple Watch or accelerometer data, Fitbit, or other wearable data. We have motivation and adherence, which usually comes in the form of notifications, reminders, and assignments and phone calls. And then we have, once we've collected the data and run our digital health study, or once we're piping data to a clinician, we have to decide what to do with that data. And so we need a data pipeline. And so this would be piping the data to Google Firebase, Google Cloud Storage, and then even transforming that data so that it's available on a service like Google BigQuery. Once you've kind of collected these data, you then need to analyze these data. And so you can push these into other services like Google Cloud Looker, Google ML, or even use Google BigQuery in order to fuel your R tables or Python tables. So these are the main kind of 6 ingredients that almost every digital health app uses. And that's a really, really tall order, not just to do that, but to do it in a compliant way. The HIPAA compliance is a really, really big obstacle for most digital health innovators. In fact, it's such a task that the average outsourced development budget for an mHealth application is $200,000. And the average timeline is 15 months just for development time. And I know when I started innovating in the digital health space, these were surprising numbers that I didn't believe. But ultimately, with the different apps that I've built, these have kind of popped up, and this ends up being really the mean. And so with CardinalKit, our intent here is to build you a cable car. You know, we don't want to take you all the way to the top of the mountain and build your app for you, but we want to get you, you know, far enough so that you can, you know, climb to the summit. We want to get you, you know, past a lot of the bigger obstacles that as digital health innovators, you shouldn't necessarily be worrying about. So this is CardinalKit. It's an open source platform and code base for digital health research and applications. So what really is it? Well, it's a compliant starting point for an mHealth researcher that might save you $150,000 in 12 months of development time. We leverage existing code to connect critical services. And so, you know, on the phone, we connect HealthKit and ResearchKit and Bluetooth sensors with a backend provided by Google Cloud. And so really CardinalKit is this piece in the middle. I mean, iOS provides a great suite of features and code bases that can be used to manage and study one's health, you know, with iOS and the Apple Watch and ResearchKit and HealthKit. And on the other end, Google provides an array of services that are HIPAA compliant and covered under a BAA that can help kind of ease this problem as well. And so what CardinalKit really does is it kind of plugs these services together in a way that it gives you a starting point to save you a lot of time and a lot of effort and a lot of money. And so to talk a little bit about the data pipeline and architecture, so CardinalKit uses what's called a serverless backend. So there's not a server kind of in a closet somewhere, you know, holding the HIPAA secure data. Really what we do is we leverage the Firebase SDK, and we also leverage a cloud identity and Google Identity to perform, you know, authentication and ensure that the person using the application and accessing those data is who they say they are. The data are then piped into Google Cloud. And so we pipe the data into Google Firestore, which is a NoSQL database. We typically pipe any type of images or other captures or files into Google Cloud Storage. And eventually we pipe those data into BigQuery so that they can be analyzed. So here's kind of a list of the services that are ready for use. So when you download your first kind of CardinalKit application and build your sample app, these are some of the things that are built in and kind of ready to go. So we have a lot of common medical surveys. You can collect passive and active sensor data. We have a community that we've already started, but we need your help in building. We want to build a community to accelerate digital health. And we feel that with everyone that's here and joining us today, we can do that together. We offer offline support as well as integration with Bluetooth powered wearables. So I want to touch on one other piece because HIPAA can be really confusing for people. Now, CardinalKit is a starting point, and it's just one part of the HIPAA equation. Oliver touched on HIPAA a little bit earlier. You know, here are 7 elements of HIPAA compliant. You can see that the technological part is just one component of HIPAA compliance. And as Oliver said, there's a shared responsibility. We've partnered with Google Cloud and we leverage Google Cloud services because they have such a focus on security and privacy and have probably the most robust privacy and security architecture and system that's available anywhere in the world. And they make that easy to use and accessible for us as small developers. You can read a little bit more about their offering at this link, where you can kind of also read about their BAA and what services are covered under Google Cloud, their BAA, and which ones aren't. So here is something that Oliver presented, I think, earlier, but this is a shared responsibility matrix. So as you can see, just because you're using CardinalKit or just because you're using Google Cloud, that doesn't necessarily mean that you know, as a research team are adhering to the HIPAA rules. So it's really important that you work with your research IT department or your university and your IRB to ensure that that the architecture that they're providing you with is compliant and you're adhering to HIPAA. But you know, CardinalKit and Google Cloud are a really, really great starting point that really solve some of these technological issues for you. So here's just a list of some of the first apps that were built on CardinalKit. So we have VaskTrack, which was built here at Stanford SSmart, which I think you'll see a little bit more about this weekend. CareKit is another one, and then NeuroCoach. And here's a quick demo application showcasing SSmart, which is an application built in partnership with the VA. And so you can see, you know, as we start a consent process, so this is informed consent. And this is made possible by ResearchKit. But we make it really easy to leverage this. So this is your 2-factor authentication where you're actually being emailed a link to access the application, having your identity verified, and then a PIN code. And now we're leveraging CareKit. And here's a basic survey about your activity and your mood.
It's important to mention that a lot of these are templated, a lot of these survey questions. You know, it's very easy, and you'll hear about it later today, about how
Absolutely.
how we've tried to make it as easy as possible to implement.
And that's really been the goal with CardinalKit all along. And here's just kind of a user profile with some more information. So one thing I want to touch on is, you know, we built CardinalKit not just to build this and provide it for the world, but we actually want to build a community. And so everyone that's here today, we want you to be a member of that community. We'd really love you to join and help us, you know, fulfill our mission to accelerate digital health around the world. And here's how you do that. The first thing to do is go to cardinalkit.org. There's a link for you to join our mailing list. You want to fork our code base and follow the tutorials on our website, and follow the webinar that we'll be giving today, kind of showing you how to build your first kind of sample app, your Hello World app. But then once you've built an app, you know, go to our GitHub page, maybe pick a feature and try to build it. We have some really, really easy to approach features that are in our backlog that we'd love for you to fulfill, and submit your first pull request. And you know, once that pull request gets merged, we'll send you a CardinalKit contributor sticker, and then you're part of our community. So we really appreciate everyone joining us today. We're looking forward to a really, really fun Buildathon, and I appreciate your time and your interest in CardinalKit, and just want to thank you for your time.
That's great, Mike. Thank you really for the overview, and Brandon as well. I think you both did a great job, and hopefully you've learned a lot. We're now coming down from 30,000 feet. We're maybe at, I don't know, 5,000 feet, and we're going to get lower and lower. We're super thrilled and excited for the next session to have, you know, very obviously talented Apple Health team engineers and Google Cloud engineers join us. But we're going to take a 4 or 5 minute break, and then we'll continue after that. So we'll see everyone shortly.
Hello, yes, I can hear you fine. Just one sec, I'll start presenting now.
Perfect. All right, we can see your screen.
Awesome.
Thank you.
Good evening, everyone. I'm really happy to be here. I feel really fortunate to be invited in this really impactful hackathon. And I'll try to bring some information around how Firebase can really help speed up things, how to build your app and gather data faster, figure out how to set up a pipeline, and essentially just get some results out of it. And once you have the results, you can also use Firebase to display some of it back to the customers. Okay, so let's dive in. What is Firebase? Firebase is Google's app development platform. It's the client side for an application. And our mission is to help a developer of all sizes, large or small, succeed. And in the spirit of innovation, we think hackathon is an excellent opportunity to try out things and see which of these might be working for you. Okay. Now, Firebase is actually a pretty large application development platform. We have almost 20 products supporting developers across the life cycle of an application. And there are multiple phases. Because it's a hackathon, most probably you'll be focusing on the first phase, in particular on building your best app possible. And I'll go ahead and use CardinalKit as an example of which Firebase features can be used to make your application really great. As you can see, I highlighted here a few of the products with green and a few of the products with red. The green products are the ones that are used by CardinalKit out of the box. Essentially, if you just follow through their getting started guide, you'll be setting up Cloud Firestore and Firebase Auth. At the same time, you won't be able to use analytics, prediction, and A/B testing because these would require users. This would require the app to gather analytics data on the users, which is something that you don't want to do at this point in time. Most of the other products, however, can be used independently, and you can enable them one by one whenever you need them. I personally think that during the hackathon, you might want to give maybe try out some of these. In particular, cloud functions, storage, hosting, and machine learning might be some things that could boost up your productivity. And I'll go quickly through all of them and explain how each of them integrates in the broader picture and what problems they help you solve and for which problem maybe they're not the best fit. Okay, as you know, your primary platform this time will probably be iOS. Maybe you'll also have some elements of web. And both of them are fully supported by Firebase. And so, yeah, let's see what we can use out from Firebase to just help us build faster and better. And first right here, it's the database. One of the main reasons why people use Firebase is to have a front-end database to store the data that comes from the app or to the app. As you can see, it's a NoSQL document collection real-time database. And let me quickly explain what each of these capabilities mean. So on the server side, we've got a lot of features that database aficionados really appreciate, like multi-region support, which means you get to have access to your data for 5 nines availability. Also, we ensure strong consistency, which is important for a lot of the use cases that you might run into, and it horizontally scales. That means no matter how much data you'll be throwing at it, if you build it properly, it will just scale. It will just work with minimal to no effort. Now, in order to ensure that the data is secure, and that's probably the most important aspect of it, next to the scalability, we have a set of security rules. I'll go into some detail in 1 minute, explaining how you should be. I'll be explaining essentially in 2 or 3 minutes what you should be paying attention to when writing security rules, when configuring your FHIR store or storage product for the first time, and how to make sure you stay secure throughout the life cycle of a product. And also, the other cool thing about Firebase, FHIR, essentially about most of the Firebase product, is that you're not really just limited to interacting with them directly. We have ways that allows you to integrate them with other products. In particular, Cloud Functions is what allows you to easily communicate with third-party systems and do a lot more with your data than you would otherwise be able to, without having to worry much about setting up the infrastructure for your product. Okay, so let's quickly sum up what Firebase is from a customer perspective, from a SDK perspective, and go through some examples of usage. So most importantly, it's effortless syncing. So that means that no matter which device you are on, as long as it's supported, it will be very easy for you to write data to and from. And if your device goes offline, normally you won't have to worry about this. It will just sync up automatically as soon as it goes back online, which is an important thing when you do in-field applications. The next thing, which is pretty cool, is that it's, like I already said, cross-platform. That means you have a lot of flexibility later on if you decide to continue working on your hack. Okay, so how is the data stored in FHIR store? A document is essentially just a list of fields, and each field will have some kind of data. If you're familiar with scripting languages like JavaScript or other high-level languages like Swift, you probably already understand the type of data that this document contains. And all these documents are, each document would be included in a collection. There will be a bunch of top-level collections. Essentially, there will be there will be a top-level collection for each of type of your documents, and then you can have sub-collections inside the documents. This way, you have a lot of flexibility on how to organize your data. So what you can do is just start gathering the data you need now and not have to worry too much about how your data store will evolve over time. You essentially have a lot of freedom to add new structure to it as you need it. Also, querying data is pretty intuitive. We don't offer an advanced way to query data, but the capability should be enough for most of the client-side reading operations of your data. So essentially allowing your customers to see the data that they inputted themselves and to act upon it. The queries are quite similar to what you'd see in any other database system. It's a NoSQL database, so you can't easily join tables or data together. And if you need to do that, your best bet would be to just export the data to a different storage inside Google Cloud. But for most use cases, you'll be just fine querying them essentially one by one for your client application. Of course, this allows us to easily scale horizontally, so you don't have to worry about provisioning your machines yourself. It just works. One thing to remember when working with Firestore is that each document is limited to 1 megabyte in size. So if you're gathering data from your customers, which is bigger inside than 1 megabyte, you probably just want to store it in something else, something different. For instance, cloud storage can be a great addition to Firestore, and the safe security rules and the SDK that you'd use to access it is very, very similar to the one that you'd use with Firestore. So it feels very seamless. Okay, now let's talk about security. Since the main theme of this evening is health, and because healthcare data is really, really sensitive, there's a lot of personal data, security is even more important than in some other industries. So one of the fundamental things that you want to look into is making sure your data is absolutely secure. And since Firebase allows the client applications to directly query the data, it's critically important for you to have some kind of rules essentially controlling who should be able to access what. They're very easy to write. There are also a few automation tools that should help you do things like testing your rules, making sure no unauthorized access is allowed. And also even generating your rules if you have an interface declaration, for example, in a protobuf code, so that you can reuse the same interfaces throughout your ecosystem. Of course, this is all optional. It's up to you to decide the ideal balance. But what's important for you to do from the very first moment is to enable security rules and be really defensive about them. Essentially, what you don't want to do is just have an allow if true or something like that. You want to be really, really strict about what you offer your users access to. And so this is definitely an anti-pattern. Another thing which I want you to remember looking at this slide is that the rules are optimized in a way that as soon as you allow an operation, the rest of the rules will not be parsed. So that's why it's really important to not have over broad reaching rules, since once you have a rule that allows access to a resource, you cannot later on say, okay, I want to take it back. That's why I just open small doors for the very specific operations that the user needs to do on the data, and you'll be fine. Also because the rules are in a human readable form, and they're usually pretty easy to keep together. That means you'll have a really good understanding on who is allowed to do what over your data. So that shouldn't be a big concern if you have everything set up properly. Okay, one more thing to remember is how the rules are actually getting applied. For example, here we have one operation in the Firestore. We write a document that's called bar to the collection that's called FHIR, and we set a base value of 1 inside it. This security rule will make sure that we are only allowed to write the document if there is a base value of 1 set on it. And this kind of rules might be really, really useful for you when you start gathering user data, since it will enforce both security as well as uniformity into your data. So if you feel like you need to have more control over the data, or if you just want to enforce a certain format to prevent errors down the road, security rules are great for this. Also, the security rules are great for limiting the way data is being queried. So for instance, if you only want to allow users to read a certain type of only resources that have a certain value in their keys, you can use that. Of course, at the same time, you'll have to do the same. You'll have to apply the same condition in your filter. That is, if you don't use a filter, the entire query will fail. And the reason here is that we try to be really conservative about how we apply security rules. So if there is even the smallest chance that the requested documents would not satisfy the restrictions you placed, we'll just stop the entire query. So in this case, if you want to have some restrictions over the type of data that's being queried in a collection, you have to remember to always add this filter in your query. Security rules are not filters. Security rules are primarily used for making your data secure. So let's quickly summarize. So by default, we don't allow access to any resources. It's up to you to open the resources that you need, and please be conservative about this. Second is, while the rules don't cascade, which means that each collection has its own set of rules, the rules parser will stop processing them as soon as you have an allow. So deny by default, but stopping processing as soon as there is one allow rule that satisfies your condition. And third, rules are not filters. If you need to filter data, you need to use filters in your queries. Rules, however, can make sure your queries are not overreaching and are not really getting access to the data they shouldn't. Okay, now that we have an understanding of what security rules are, let's go through the next important concept, authentication. While security rules take care of the authorization portion of the auth workflow, authentication is what allows us to know who the user is. It's also very easy to use. We provide support for quite a few popular platforms, and of course, we also support email. And if you look at the getting started code, you'll see that the kit actually uses passwordless email authentication, which I think is one of the best ways, since it's very inclusive. Most of the people will have an email nowadays. It's also secure, since they don't have to remember yet another password. They can instead just use their primary email. Of course, if you need more than this, there are options to make much more on top of Firebase auth. Okay, now once your customers are authenticated, and once their data is included in the app, you might want to do something with it, and that's where Cloud Functions come into play. By using Cloud Functions, you essentially deploy JavaScript to the cloud, and having that code run in the cloud allows you to have it triggered based on events. And these events can be anything that has to do with the data in your database. They can be also third-party events, for instance, HTTP requests to your service or a pub/sub notification. It's up to you to decide which triggers work for you best. But the concept here is that you are not limited much on how you would integrate with a third-party system. And if JavaScript is not your cup of coffee, there are ways to bridge this to other platforms. You'll essentially still have to use a small portion of JavaScript code to forward the call, but after that, it's up to you which platform you use. Okay, so let's look at an example. So here, our customers uses Firebase. Of course, they will be storing some data, and maybe some data will not be really appropriate to be used on their device. And there can be one of the three reasons. First reason might be that maybe you don't trust the customer device to do certain operations, since it's out in the field. Or maybe you need to join some data together, and yet again, you cannot trust the customer device to not try to access data they're not supposed to. So one reason to have something like Cloud Functions is whenever you need to process data that you don't want to process on the customer device. The other reason might be that maybe you have some kind of business logic running cross-platform, and you don't really want to maintain it in multiple platforms. While this might not be the case now, it might become a case to consider in the future. The third reason is when you have CPU or GPU intensive processing to do, particularly with ML. The more complex ML algorithm will not scale very well on customer devices. With the cloud, however, you have almost unlimited resources. So yeah, what happens? What happens? How does a workflow like this work? First of all, the customer will sign in and auth will take care of that. Next, they're probably going to be saving some data to Firestore, maybe make a profile, maybe record some wellness data. This data will be stored in Firestore from the customer device. Then, depending on how you wrote your cloud function, this data can be sent over to a third-party system for processing. One way to easily do that would be to use, for instance, PubSub to send messages to other Google Cloud platforms, or web requests if you want to use third-party RESTful APIs. In a very similar way, you would work with cloud storage. So anytime when you want to save data that's too big to fit in a database, or maybe it's not textual, maybe it's binary data, so you don't really need to query based on its values, cloud storage might actually be a better option than Firestore. Its primary use is to store and serve media content. So anything like images, videos, or any other kind of data. Also, it scales automatically, and it has the same security rules. Hosting. Hosting is just a really easy way to store a front-end web application. Not much more than this, but it's just nice to have it there. It also allows you to have custom domains associated with your Firebase product, which might be useful if you want to brand your experience to your domain. You can also use it for just quickly publishing data on the internet, quickly publishing simple ways to access your data to the internet. Okay, one of the things which might be really interesting for you folks here are the machine learning capabilities. Firebase used to have an ML-Kit product. Now recently it has been split into two components. One is the ML-Kit, which the ML-Kit product, which now lives as a separate entity, and it allows really good on-device ML capabilities. And there is also the machine learning portion of Firebase that simplifies talking with machine learning in Google Cloud. Which one will you use? I would say the client-side one is really good for validating the data on input, just making sure your users are providing the right kind of data. It might also be used to make the experience more seamless. So for instance, instead of having to input a long sequence of numbers, they can use a barcode reader to quickly scan a label that you offered them beforehand. Another example would be to use face recognition in order to easier gather some kind of data, or just validate that the data is in the right format. Other things could be labeling images and so on. Generally, for on-device algorithms, the on-device algorithms are usually useful for direct customer to device interaction, essentially just making the input-output process easier. And the server side cloud ML is generally useful for research purposes and to do any other data-intensive loads. Depending on which one you'd be using, you'll either have to look into Firebase machine learning or at the ML-Kit product. Okay, I'll quickly cover also extensions. So what are extensions? Extensions are ways to very quickly add some common functionality to Firebase that is not provided out of the box. Generally, when you think about adding a feature to your hack or your product, a good idea would be to just quickly check. Maybe there is an extension that does exactly this, and if there is one like that, you can use it. Or if you don't quite like some aspects of it, you can just take a look at its source code and use it as inspiration for your own cloud functions. Okay, that concludes our build application section. I will very briefly go through the other two pillars so that you just know what to expect, since you might run into these a little bit later. Okay, Crashalytics prevents crashes. It's worth looking at it once you start deploying it into in-field, particularly if you're deploying it on more than one type of device, or you have more than one version out there. Performance, it's probably useful at a later time in your game once you have some customers, if you want to just make sure the experience stays really good as you add more features. Test Lab is useful when you want to deploy it across multiple devices. Probably not really a concern at the moment. And Grow and Engage. Cloud messaging. Cloud messaging is a great way to engage with your customers. They can be used to remind them to do things, or to just follow up on in certain workflows. You probably won't be using the analytics, at least probably within the scope of this hackathon, but other than the other aspects might be eventually become interesting. Remote config. So remote config is a way to turn on and off features for your app remotely. It can be really useful as a tool for demoing. So for instance, if you gather some data and then you have a really long process that should run in the backend, and you just want to show a demo that's fast and easy for your customers to go through, you can use, for instance, remote config to push state changes easier. Also, of course, you can also use Firebase. You can use Firestore for that. But remote config gives you a little bit of flexibility around the things you can do. It's cool to check out if you need to control devices remotely, particularly if you need to control more than one at the same time, based on some criteria. Okay, and dynamic links. You are already probably using this. It's essentially a way to guide your customer through your product journey easier. They will open a link which would get them into the App Store if they don't have your app installed already, or will open the app directly if they do, and it will also save the context and the session. So that's it. Thanks a lot for giving me the opportunity to speak, and I'll be hanging around on the chat on Discord if anyone has the questions or needs some help around Firebase.
Thank you, Alex. That was really thorough. I mean, you can see how powerful, this sort of a serverless application and how quickly you can iterate and implement. It's a really powerful combination. So we're, really appreciate the time that you've taken to explain everything and also being available to answer questions. We're going to take a quick 5-minute break, and then when we come back, the SHIFT team is going to talk about SHIFT a little bit and also team building. So 10 minutes. All right, sorry. 10-minute break, which is even better. Bathroom break is needed, so good. All right. Thank you, everyone.
Okay, sounds good. Welcome back, everybody. So for the next 40 minutes, we'll be hosting a live Q&A. If you have any questions about team formation and overall logistics of the event. So a little bit about me and Andy, who's in this call right now. We're the co-presidents of SHIFT, who some of you may have interacted in the past with. One of our big flagship events is Health Plus Plus and Blueprint. And we're here to answer any questions that you might have about team formation. With that being said, we're going to give a short little demo on what SHIFT is about, and happy to have you guys join the Buildathon.
Hi everyone, this is Andy.
And this is Mark.
And we are the co-presidents of SHIFT, Stanford Health Innovations and Future Technologies. This year, we're so excited to be working with the Stanford Center for Biodesign and our industry partners to help host the Cardinal Kit Buildathon. We wish you all the best this weekend as you work on your projects. We wanted to take some time to share more about SHIFT and how you can get involved with our very exciting initiatives this year. Our mission is to empower students to move healthcare forward by creating a platform for developers, entrepreneurs, and pre-health students to meet the growing needs and demands of healthcare innovation.
Our first program this year is the Blueprint Datathon, which will occur in late October of 2020. Blueprint is a weekend-long virtual datathon where participants apply cutting-edge data science techniques to develop solutions to challenging problems in healthcare. This year, we expect to have several large datasets relating to the economic and health impact of COVID-19. We invite all of you to apply to the Datathon. Applications and further information will be released in the next month on blueprint.stanford.edu. Stay tuned.
The next program is our flagship event, the Health Plus Plus Hackathon, which will take place virtually in early May 2021. The event brings together hundreds of students and industry professionals for a weekend of ideating, designing, and building. You will work with interdisciplinary teams, hear from top leaders in the health tech field, and present to an esteemed judging panel. Check out our website at healthplusplus.stanford.edu for more details.
And finally, for Stanford students, SHIFT will be running our annual Artificial Intelligence in Healthcare seminar, CS 522. The course is a one-unit weekly speaker series featuring talks from leading researchers, physicians, and entrepreneurs, including the VP of Apple Health and the Director of Health and AI for Social Good at Google. We encourage you to enroll today and look forward to seeing you there.
So thank you so much for participating in our Buildathon. Best of luck and hope you have a wonderful weekend.
Okay. With that being said, if anybody has any questions about team formation, welcome to field questions either here or on our Q&A channel in Discord. And this time is more so for participants to finalize team formation and hopefully have a team by the end of today.
If anyone has questions, feel free to ask now, sort of in the Google Meet or also in the Discord Q&A. Any questions about team formation or about the initiatives for SHIFT that we just showed in the video? We're happy to answer anything that you might have.
So one of the questions that we got is, do we need to register our team? So for team formation, there's nothing that's required by the end of tonight. Obviously, you'll have to register your team for final project submission, but as for now, there's nothing to worry about. Just please try your best to search out any projects that you might find interesting, and feel free to form your team.
So in the Discord channel, there is a section called Project Pitches and Team Formation. So everyone is encouraged to use that as a platform to find teammates if you haven't done so already. And the Discord link is sent in the chat for those who haven't accessed it. Sent by Amir.
Hi, I'm not familiar with Discord, and I use my username login, and then it said something about claim the account. Is that necessary step before I can see the announcement? It shows that I'm in Stanford Biodesign Buildathon. Yeah, but I cannot see the announcements.
Yeah. So that's a good question and something that is applicable to everyone who hasn't joined the Discord yet. So upon joining the server, we have a rules channel that you have to first agree to in order to be given full access to all the channels. So make sure that you're able to read the rules, read the guidelines, and click on the green check mark, and that should give you full access to the server.
Okay, thank you.
Yep. One of the questions that we also got was, how do we define our role? So one of the features that this server has is that you're able to self-assign your skills and expertise, as well as your job status, whether or not you're looking to hire people or looking for a job. So head over to the assign roles channel under the roles category and do a /role and then your area of expertise or your job status, and it should give you that role. Yep. Yeah, that's a good question. So most of the team formation is done within the project pitches /team formation category. So under that category, we have multiple channels completely, devoted to a specific category or healthcare category. And participants are welcome to pose any sort of pitches or ideas that they're interested in, as well as introduce themselves within that server. And after that, most of the team formation is done by networking between the participants. And we also have a project pitch Google form that we've already sent out, but we'll also send out again as well.
I'll just also add there is a section called pre-form projects. Some of them already have completed their teams, but if any of those interest you, that could be another option. But otherwise, the project pitches and team formation section, like Mark said, is the best location for that.
So, but because I just, thanks for letting me know about the agreement and the rules that need to be checked. And it seems that all the codes are going to be open source, right? So in that case, would that apply to if you have a project that has already been ongoing before the Buildathon, then it's going to be open source after this, or just the part that is built during this weekend?
I think maybe we can answer that specifically through Ticket, and or at least the Shift team is not too sure yet, but we can definitely direct your question towards somebody who can answer that.
Okay, thank you.
That's a good question. We'll get to the original poster of the question as soon as possible with a list with sort of a more fine-tuned breakdown. Yes.
So one of the one of the questions asked within the general chat was, how can we share our screen with our team? So most of the, I guess, inter-team collaboration will be done on your part, and we won't necessarily be hosting any Zoom calls or Google Meets. So hopefully that can be done on your part as well. And just a little bit about our ticket system and how you can reach out to our staff during and after the event. We have an info booth channel set up to ask any public questions. And if you have any sort of private concerns or any questions that you'd like to ask privately, we have a create a ticket channel where you can simply click on the envelope reaction button, and that'll put us in touch with you.
Cool. Just to follow up on the category of awards for everyone to hear. So the categories include the grand prize, the best need, as well as the best COVID-19 related project, the best project using the LIFT API, the best app using the Cardinal Kit framework, and the best Cardinal Kit feature. Those are the categories. And on the submission form, you will be asked to check which of these categories, potentially multiple, that you would want your project to be considered for. Everyone will be considered for the grand prize and the best need statement. Hope that clarifies whoever asked the question and information for everyone else.
So maybe I ask another question. In case you I missed your discussion. So is it necessary to use all of the Cardinal Kit I mean, that means ResearchKit and CareKit, right, as together, and then Firebase and everything, or is it only a combination, or like what is the minimum that is required? Is it always necessary to use CardinalKit for this project?
Yeah, so I can answer that, and maybe somebody later will hop on to this Google Meet to answer it more in depth. But I believe that we're not requiring participants to utilize CardinalKit. Amir or Andy, correct me if I'm wrong.
Hey everyone, this is Mike. No, we're not requiring people to use CardinalKit, but if you feel like it's a great starting point for your app, we certainly encourage you to. There are a couple prizes that are associated with using CardinalKit, but if it's not a good fit for what you're trying to build, then yeah, no worries. I think there was one other question that somebody had just about kind of open source and what that kind of requirement means. Yeah, so I think that what we're trying to do is to say, hey, whatever you build this weekend is open source. I mean, if you kind of leverage some other technology at some point in time, yeah, I don't think that we're asking you to open source that, but we're just asking you that, whatever you build with your team, like over the weekend, that's kind of offered to the open source community.
Okay, thank you. Thank you.
Yeah.
I have a question. So I can see how we can have like surveys and collect data directly from the users on these applications. However, it's really interesting to be able to integrate that with the EHR data. Is there any way we can access like test EHR data if you're interested in doing some sort of like back-end integration for our applications?
Hi guys, this is Santi speaking. Can you hear me?
Yes. Yep, go ahead, Santi.
Great. Just to quickly answer that question, if you're interested on getting some fake or sample EHR data, one thing that you can try is that if you do interface with the Apple Health Records API on a simulator on iOS, it will give you some sample data that you can use. It is meant to simulate an EHR environment as closely as possible, of course, within Apple's ecosystem. But I think it should be a great place to start because it does give you data that is formatted in the FHIR format and could be used for any kind of analysis.
Great, thank you so much.
Yeah, and a follow-up to the questions about awards and prizes, we'll be posting it in the announcements channel later tonight.
we'll be here for another minute for the Q&A in case anyone has questions, but then we'll sign off. And if you have further questions, you can reach the Discord channel for Q&A.
Thank you, Andy.
Thank you. Yeah. Good luck, everyone, on the Buildathon. We hope you have a wonderful time.
For the next session, we're going to have Santiago Gutierrez and Varun Shenoy. They're going to take us through building the sample app using the Cardinal Kit framework. And I believe, I see Santi. I don't know if Varun's on. Santi, are you going to kick it off, or is Varun?
I'm here.
Okay. Oh, you are? Okay, I'm sorry. I didn't see you. Perfect.
Varun will kick us off.
Okay.
Yeah, let's do it.
Well, why don't you definitely take a minute and introduce yourselves?
Sure. My name is Varun Shenoy, and I'm a part of the open source and software team at CardinalKit.
Hey, my name is Santiago. I'm one of the co-founders behind the CardinalKit project and one of the tech leads.
Awesome. With that, I think we can get started.
Let's do it.
Cool. Can everyone see my screen?
Yep.
Awesome. Okay, so to kick off this workshop, we want to begin by going over a couple of resources that everyone who's working on something related to CardinalKit has access to. So first off, I want to share the website, cardinalkit.org. There's a lot of useful information here when it comes to developing projects within the CardinalKit ecosystem. One thing I want to point out right now is the mailing list. If you're interested in staying up to date on anything related to CardinalKit, as we continue to build and make it better, I'd highly recommend subscribing to our mailing list. We also have a lot of interest forms. So if you're a developer who works on, wants to build a health kit apps, you can sign up and be a developer. And if you're a research team, if you have some sort of need that you need a developer for, you can go ahead and fill out the research team interest form. And we're going to try and match both sides of this equation together and try to get these research teams who otherwise would have a really hard time building survey applications, have a much easier time using CardinalKit and having developers. Along with that, we have office hours. So we have regular office hours with Brandon if you have any questions about CardinalKit. And we also have technical office hours with me and Santi every Friday from 1 to 2. If you have any questions, both of these link to a form. You can just go ahead, fill that out, and we'll try and get back to you as fast as possible. But obviously during the Buildathon, we're going to be available during any sort of office hours to help you guys out, always on Discord. On top of that, I also want to go ahead and share, let's see, we have a section for contributions, so GitHub and requesting features. I'll be going into that in a few minutes. And we also have a bunch of partner projects. So these are projects that have used some pieces of the CardinalKit framework in the past and have been able to deploy their solutions and have had great success. With that, I'm going to show us the community tab first. So we have a bunch of events that we're hoping to align. Right now we're here, but we're going to keep filling out our list. So if you're ever interested, just pop on over to the website and see if we have anything going on in the next couple of weeks. And finally, resources tab. We're going to continue to keep updating this, but as of right now, it sort of provides a very summarized and succinct guide to building health research applications. It takes a lot of this complex information that was presented earlier at the Buildathon and really condenses it just down to one page. So you can just come by and see what you're trying to do, get a better feel for what it means to build a research application. All right, with that, let's go on over to, so let's go ahead to the documentation first. So a very important piece of CardinalKit is documentation. If you're new to CardinalKit, you're probably going to be spending maybe an hour here at the beginning of the Buildathon to sort of just get set up. So we have a couple of pages to generating CardinalKit app. This involves setting up Xcode and CocoaPods, which are basically the fundamental tools that CardinalKit uses to help you build iOS applications in the health ecosystem. And then there's also setting up the application infrastructure. There was talks earlier that talked about how you can use HealthKit to connect to a backend. So we're actually going to use Firebase for the backend because it's very easy to use and set up. One thing I do want to point out here is we have two separate branches. I'll show in the GitHub, but when you're following this application infrastructure documentations, follow it very carefully because there are some points where those two steps like to sort of meet a fork in the road. So be sure you pick the right one. Finally, there's an app customization guide. This is going to make a lot more sense when I go into the actual application demo. And basically, these are things which, without even having to write a single line of code, just text, you can customize an entire look and feel of the application. I'll show that later. And finally, there's some basic information about contributing to open source if you're interested. So moving on to the GitHub. So our GitHub is just at github.com/CardinalKit/CardinalKit. So this is the main project. So we have two branches we really want to show you. So the master branch mainly focuses on storyboard, which is a type of design element in Xcode and iOS development. But we also have the Swift UI branch, which uses Swift UI, which is a completely different way of designing applications. And the applications look slightly different, but sort of the key difference that there's right now is that the master branch involves you having to use a idea called dynamic links, which means that you can log in a user without having a password or an email. You just press a link that's sent to an email. And that's super useful, but it takes a lot longer to set up. So if you want to set up a CardinalKit app as fast as possible, I recommend going with Swift UI because it has email and password rather than dynamic linking right out of the box. And I'll be showing that a little bit later. Also want to share issues. If you have any ideas for cool features that would be a great fit in CardinalKit, please go ahead and leave an issue. If you click on new issue, it gives you a couple of options. You can go ahead and do that. If you have any ideas, just come by, leave a feature request. We have a ton right here. And there are actually teams in this Buildathon which are actually going to try and complete some of these awesome features. There are a couple of goodies you get if you do complete any of these features. And Santi and I are more than happy to help you along that progress. So as you can see, adding COVID-19 surveys, you know, a lot of stuff dealing with, you know, if you want to build an Android version of CardinalKit using ResearchStack, or creating a, for example, a web portal. That would be a super cool project to work on in this Buildathon because now people don't have to use Firebase. They can just access the web portal and see what their data looks like. It's great for physicians and clinicians. But again, if you have any ideas, please leave them here. We'd love to see them, and we'd love to get people to work on them as well. With that, I'm going to get into the CardinalKit application. I'm going to switch out what I'm sharing. I'm going to go ahead and share Xcode. Can everybody see Xcode? Can someone give me like a, okay. Yep, you're good. Awesome, fantastic. So what I have right here is the Xcode project under the Swift UI branch, which I showed earlier. And there's a ton of files in here, and we're going to be playing around with a little bit of these. But right now, I want to show this one file called CK configuration. This is, you know, relates to the documentation I showed earlier, where you just have to change some text, and it shows up in the app right away. So let's go ahead and let's just try the default application. So that's right here. Yeah, that's right here. So as you can see, it opens up. There's a little panel which you can swipe around. It's all customizable. Let's go ahead and join the study. And this is the whole consent process. It's all built in ResearchKit. And let's hop through this really quickly. And finally, you see your entire consent form. So we can go ahead and agree. Let's go ahead and fill this out. And now this is the email password registration I talked about earlier. And the passwords are all going to be secure. It requires a special character. It needs at least, I believe, 6 or 8 characters, and needs numbers, capital letters, and lowercase letters. You can specify this with source code. Let's go ahead and confirm that. So I got a network error here. Let's just see if I can try again. That seems to help a lot of the time. There we go. So the account was made, didn't get an error. But as you can see, Firebase actually has that built-in error catching, which is awesome. So you don't have to hard code any of this stuff. You get access to all of this right out the bat. So let's go ahead and log in. Another great feature right out of the box, you connect Firebase, you got the whole reset password feature built in as well. Sends an email and you get to reset it right from there. Anyway, let's go ahead and log in. So now I'm logged in. Create a passcode, confirm the passcode. And now it's going to ask for some health data, some specific HK quantity types within HealthKit. This is all customizable within the plist. So let's go ahead and just accept, and it's going to be reading this every so often, however as much the developer wants it to read it. So we're in. So actually, let's go ahead and let's just take this coffee task right here. It's going to just ask one question and say, how many cups of coffee did you have today? 3, sure. And it should save that right away into the database. So let's go into the Cloud Firestore and Cardinal Kit. See, there are 2 users here, so it's actually going to be this user, which is created right now, and you can confirm that. They're going over to the profile and seeing the patient ID. So this is how we keep it HIPAA compliant. We don't ever see the patient's name, but rather we just see the task. And we see scale answer 3. Awesome. So now let's do some customization. Okay, so I have another configuration plist here. And what we're going to do is we're actually just going to swap them out. So we're just going to call it old, and we're just going to call this CK configuration. Let's get this to work. Perfect. So now we have a completely different configuration file. So different study name, different study title. It's asking for different health records, and it has a completely different consent form. And what I'm actually going to go do is, before we had the coffee task, I'm actually going to go into study tasks and show you where that coffee task is. There's also other tasks here. So for example, an SF12 task, which is a very common task used on medical surveys. So actually, instead of using the coffee task, which I've already showed you, I'm going to swap it out for the SF12 task and an activity task. So here's where the coffee task is described. So let's go ahead and comment it out. So this is code, but even if you don't understand Swift or any sort of programming language, you can see that all it's really doing is, we're asking for one coffee task, and we're basically describing what we want that to look like. And we even have a UI image for coffee icon, and that's basically something you can just drag and drop. Let's go ahead and uncomment these lines out. So we want one survey task, which provides an SF12 task, and we want an active task, which is going to provide a walking task. So with that, let's see. Actually, let me go ahead and show the images as well. So in the assets.xcassets file, Here's the coffee icon, but here's also the survey icon and activity icon. So now what I'm actually going to do is I'm going to do two things. First, I'm actually going to go ahead and show the consent document. This takes a moment to load, but I don't want to forget to show this. And right now what it's doing is it's taking that whole survey document that I showed earlier that you specified, turns into a complete PDF with the signature, patient's name, date. It's perfect. You can export it to an actual iOS device and send it to a doctor or family, but it's all stored on device. So with that, I'm going to go ahead and delete this app. And I'm going to run the app again. But I'm also going to do a couple of changes here in the Firebase database. Remember that I already created an account with my email. So I actually want to go ahead and delete that so we can run through that entire process again. Awesome. If you want, you can go ahead and, sort of clean up the data here as well, but it's fine because I already showed you the unique user IDs, and we can basically identify where our data is by that ID. So now we're just waiting for it to run. So now the app is booting up. Let's give it a minute. Awesome. So right off the bat, you see it looks entirely different. We haven't changed that much code at all. We just changed a little bit of text. We added a couple of different slides. Now there's 4 instead of 3. There's also a different color in this entire survey right here in the consent form. There are actually less steps as well. And as you can see, all the text is completely unique. And I specified that in the configuration file. And I can just agree to it right here. Let's go through the whole process again. Should create another account. If I did have another account under that same email, it would have alerted me. But luckily, we went ahead and we deleted it beforehand. Let's go ahead and log in here. Same process as before. Enter a passcode, confirm the passcode. It's going to ask me for some health data. And this is completely different health data than before. Let's just go ahead and turn them on. And we're done. Now we're in and we see the 2 separate tasks. Everything else here is slightly customized as well. You can see a different patient ID. Let's go ahead and finish a really quick survey. Cool. And now let's go ahead and check in the database right here. So let's go ahead and reload Firebase. So there's a completely different survey. And we remember from before that our ID starts with the B. So that must be the user we just created. And there's our survey task. And there we go. There's all the different scale questions. Yeah, so just by changing very little, just by changing this, so we can get both of them to pop up at the same time. Just by changing this configuration file, we were able to get a huge difference in how the app actually looks, runs, and feels. And we wrote a little bit of code, but it was fairly easy to understand. And now we have an entirely different survey that's able to actually send data to the backend and store it. Awesome. Are there any questions? Let's see. Okay. Cool. From here, I think I'll pass it off to Santi, who's going to talk a little bit more about how you can actually create your own surveys in ResearchKit and CardinalKit, and provide us with more depth on exactly how we go about doing that.
Thank you, Varun. That sounds great. So I'll be doing just that, by giving another overview of the Cardinal Kit framework. I'll take my time, be a little bit careful here, and show everybody how you could find the value of Cardinal Kit, and more specifically, how you can tell or get a good sense of where is it that you can contribute. If you are joining us via the Google Meet, please post questions on the chat as I'm going through this presentation. It's meant to be lightweight, and if you see at any point in time an opportunity for you to plug in your project or to get a good sense of, hey, maybe I could do something like this, I would say the chat is a good opportunity to ask a question so that I can answer it in real time. If you don't get the chance to, no worries. Varun and I will be live on the Cardinal Kit Discord channel for the remainder of the weekend and available for any inquiry. So first things first. Absolutely. So my name is Santiago. I am one of the co-founders and lead techs of the Cardinal Kit project. I will be one of our main points of contacts for bugs, issues, or any kind of future requests and or implementation ideas. Happy to provide any kind of input for your projects throughout this amazing weekend. So that said, and taking a quick step back, Varun just shared one of our experimental branches, the SwiftUI branch. This could be a fantastic start for your project. I recommend that if you're looking at the Cardinal Kit framework on GitHub, in the event that you want to follow along, you have those two options. I'm going to be showing the master branch, soon to be renamed main. Varun just did a quick rundown of what our SwiftUI branch looks like. He mentioned a couple of differences. I will add a few more, which is that SwiftUI requires that your application charges, I believe it's iOS 13, a later version of iOS. The currently what is on the master branch of the Cardinal Kit framework, that charges iOS 11, as you can see here in the background. If that defines the needs of your project, feel free to use that as reference. The second thing is that for those of you who were fortunate enough to join the session with the Apple team earlier in the day, you might have seen the amazing experimental beta features that CareKit is working or has unveiled that are using SwiftUI at its core. If you're interested in implementing any of those CareKit features from CareKit, you might want to start with the SwiftUI branch and move on from there. So to get things started, I'm on the master branch and I'm showing us a quick in-depth dive through of the Cardinal Kit framework. So once you do go ahead and click on join study, you will see a consent process, with a couple of sections. For instance, here's one on data gathering. Here's one on, let's go to the next one. Privacy, data use. These sections are being shown and powered using the ResearchKit framework. Cardinal Kit has a feature meant to help developers quickly pull off a consent process, which is embedded directly into our very own CK configuration.plist file. This file is meant to be a quick and direct source of customization for all of your applications that are powered by Cardinal Kit. In the topic of consent, you can see here the sessions that we just went through. We just went to data gathering, privacy, and I believe we left up on data use. Here we are. You can see the content of those sections. If you edit the CK configuration plist directly, you will see the application automatically update to reflect your latest consent. This is neat for two reasons. One, if you don't want to ask your study participants for their time commitment or for withdrawing, or if you want this to be different content altogether, you can simply just go ahead and remove a section, and that will remove it from the onboarding process at the very beginning of the screen. And two, Varun just showed a very quick and easy way to generate a PDF of the signed consent from your patients. This is the source of that PDF. In short, this is what your patients are agreeing to by using your application, right? In this context, CardinalKit uses it to show a medical consent process. You can kind of have a mix here of a terms of service, privacy policy, HIPAA consent, mix and choose and make this content really pertinent to your project. Let's continue here. What I'm going through right now is the CardinalKit sample project and sample app. This will be the source of many of your contributions if you choose to get started with CardinalKit and using this framework as a basis. One thing to keep in mind is that if you contribute to the sample app, what you're doing, in short, is you're enabling developers in the future to use your contributions as the starting point of their apps. So this came up on the issue list on GitHub earlier. I believe the question had something to do about adding visualization to the platform and where's the right step to add it. If you add it to the example app, one thing that we're accomplishing here is that we're showing researchers that want to use this framework to further their projects. We're showing them best practices and giving them a quick and easy way to get started and see what can be accomplished, and ideally also give a quick and easy way to customize. On that note, the CK configuration.plist file, it might be very interesting to you because you might find that, oh, my team has created a really robust data visualization framework. We want researchers to use it. And you might want to expose some kind of configuration here, maybe the color of your charts or how many charts actually do show up, or what kind of data is read in what format over what period of time and using what unit, meters, feet, etc. This could be a source of how you make your projects very customizable, and for your final presentations, you might be able to demo something where you change this file on the fly, kind of like Varun did, and all of a sudden you have a different interface, a different app, a different innovation altogether. So kind of moving forward with the example here on the screen, let's go ahead and click through it. This is a review of the consent process using these same exact sections. Once again, this is powered by ResearchKit, and we'll show a little bit of how that works towards the end of our session. Review the consent form. Let me just go ahead and sign this. Nothing special here. If you do go ahead and fetch the master branch, soon to be renamed to main from the GitHub repository, you'll see that our login process here is compromised of just an email. This is meant to be an alternative to the password system. It is a very safe system to use if you believe this will help ease onboarding for your patients. Rest assured, this is HIPAA compliant. If I do enter my email address here and go ahead and click on continue, the idea is that I will be receiving an email with my login credentials. Now that said, I don't actually have the Mail app installed on the simulator. So I'm going to go ahead and show us this. Here's the email that I just received. We have received your request to sign into the CardinalKit sample. If I go ahead and copy this link, let me close this. I can actually just paste it into my browser, pretend I clicked on it from an email, open link in app. Let's go ahead and do it. What this does is that this finalizes your sign up process. And just like Varun showed earlier, this will result on a user created on your database profile. Here's Varun's user, here's my user, and you can see that it was last modified right now 5757. This will result on a user created on your Firebase account. What's important here is that you're seeing and you're experiencing a project that is essentially binding ResearchKit to an active backend. So by using the sample, you have a backend ready to go, ready for you to use. We just authenticated our user, as simple as that. So it provides a framework of best practices that you can use to say, okay, what if I just want to focus on the content and use something that already has a backend implemented? I want to build on something that already works. If that's what you're looking for, CardinalKit is a perfect fit for you. And just to add a little bit more value, considering the variety of projects that some of you might be working on, this is a screenshot actually from earlier. This is a screenshot from Alex's discussion. Beyond CardinalKit, what else can you do with the Google Cloud platform? We just showed, I just created a user profile, like just answered a survey, and boom, it's now on Firestore, right? What else can you do? This is a fantastic overview of other potential features. We have some in our GitHub issue list that might provide inspiration. They might push you to do something using GCP's machine learning modules, or they might push you to do something using GCP's cloud functions, right? For instance, right after an event happens on your apps, maybe you want to use a cloud function to say, hey, this user just signed in. Therefore, I'm going to send them an email with some kind of interesting information. Who knows? The possibilities are endless. So moving back to this project, what you see on the screen right now is a passcode screen, which is powered by ResearchKit. The CardinalKit project has built in a password protection a flow and step. What that means is that when your users sign up, they'll enter a password. Subsequently, every single time that they go ahead and open your apps, they will be asked to enter that password. This is built into ResearchKit, and in case you're curious, it actually does support biometric authentication and Face ID right off the box. So if you are using this passcode approach, that it comes bundled in ResearchKit, you will be able to let your patients sign in with just their face on the iPhone 10 or higher. Moving on through a deep dive of the consent process, you see here a health data step on the screen. If I go ahead and click on next, you'll see that I'm asked to provide access for some kind of health metrics. On the SwiftUI branch, you can customize these health metrics directly from the CK configuration.plist file. For those of you with a deep hacker spirit out there, I'd encourage you to take a quick look at this CK Health Data Step View controller. If you do dive into this file, you'll see that on the master branch, there is some information here about which HealthKit data types are being read in the background: step count, distance, flights, and heart rate, which matches what we were just asked for. You can extend this list, so you can add other quantity types to be read. And here's a somewhat of a comprehensive list. Not everything here can be read in the same format, but this should give you an overview over what kinds of things you can query for. This feature is powered by HealthKit. CardinalKit provides an example by which you can get started using HealthKit. Specifically, one of the core features is that for these HealthKit data types, CardinalKit makes sure or gives you a way to actually get authorization for these types. And once you do get authorization, CardinalKit will collect information from those health types passively in the background. So what that means is that for your study participants, whatever kind of health information you need from them in order to prepare them for success, you will find that in their user profile under Firestore. You'll actually find some day-to-day information from the HealthKit store, and you'll see some information. In this case, it was my heart rate for my Apple Watch, for instance. Just as a brief overview, HealthKit is a fantastic stepping stone towards lots of other data collection frameworks in the iOS ecosystem. In fact, if you are interested on using CardinalKit to read electronic health records, EHR records, HealthKit is how you will be able to accomplish that. HealthKit is the framework by which you will build on top to accomplish that, right? So I would take a moment to actually leave the CardinalKit sample app and take us back to the HealthKit, to the Health app installed on your phones. If we do go ahead and open this, you'll see I don't have any step data on the simulator, but if I did, CardinalKit would be collecting it, which you will on your real devices. More importantly, though, if you go over to the browse category and you go ahead and scroll all the way to the bottom, you'll see some health record information. You might be wondering, where's this information coming from? If you do click on it, you'll see, well, it's empty, but you could access your records. And if you go ahead and go through access step, you'll see that while you could actually link to your real electronic records, you can also just choose one of these 3 sample institutions, A, B, and C. You can go ahead and say, okay, I want to connect this account. And what this will do is it will give you access to some health records on your simulator using fake data. So you don't have to worry about, hey, I don't actually have allergies on my phone or anything like that. Here's where you might be able to spoof something that you can use for your projects. The second leg to that is that in order to fetch this information, you will be leveraging HealthKit. And this is a fantastic topic to bring to our office hours. If this is something that you want to make a push for, please check our issue list on GitHub, find the relevant item. You'll see some comments there potentially. If not, we'll be available via Discord to share different implementations and different ways by which we've accomplished this in the past on our prior experiences. So I see no questions on the chat. I'll continue to move on. Feel free to bring any kind of question in if you would like that to be answered as I'm chatting. I can quickly check Discord. Okay, maybe not. It might. I don't actually have it on my phone loaded. But anyways, here's the welcome aboard. Thank you for joining the study. I can go ahead and finish this. And this will essentially finish the it'll finish the CardinalKit app on the simulator. So it'll take us to the main app. Let me go ahead and restart my simulator as I just added some health data, and we can get that kicked off. Okay, let's let this launch over here. After your application does launch, you'll see that every single time that you open it, you see this passcode by ResearchKit, this passcode, which was created using ResearchKit. So as a patient, I can go ahead and unlock that, and here you go. This will take me to the main CardinalKit application. So Varun actually went through an amazing demo of clicking through a survey and answering some questions. If you do this, you'll see, and this was something that Varun was showing, you'll see that whatever you answered, it will be, you can kind of see here in the background, document successfully written. It will be moved over to your Firestore instance in real time. So you'll get your responses right away over here. You'll be able to dive through them. You'll be able to dive through them and see what your patients are responding directly from your database. So I would like to take some time to show everybody how you might be able to construct your own survey. And this is one of the key things of ResearchKit that I think can help you build almost any application and can help you really realize a lot of different user interfaces. So you might be wondering how. If we go ahead and click on the survey sample, you can see that we went through a couple of questions. Those steps, Varun showed off the study task.swift file earlier in the project, rather the study table item.swift file earlier in the project that shows you, okay, I have a survey sample and an active task survey sample. I only have those 2 things. I could add a third one here to the list, but right now I have 2. for hackers out there, the study table view controller actually has a lot of logic as to what happens when you click on these things. So here we go. I'm on a table and I'm clicking on the very first item, right? What do I want to show? So I'm saying, let's show this SF12 task. This file, studytask.swift, has a couple of surveys that you can use to start with, and you can modify to meet your needs. So here's the one that we just answered. Let me go ahead and remove everything on the screen, and then step by step, go over what we are seeing. So this is our new SF12 task. If we run this right now, you'll see that we're going to start with an instruction step saying, okay, hey, actually we can see it. Hey, this information will help your doctors keep track of how you feel. Here's the instruction to the left. And if we run this right now, you'll see that the very next step will be a summary with a check mark for completion that just says, thank you. We appreciate your time. And then that's it. It goes ahead and finishes. This is a little bit about the core way that ResearchKit works, and hopefully this serves somewhat as inspiration. I have this graphic here, which I like to show, and we can go through. Here's our instruction step. In this example, we're showing an instruction, and then a question, and then a question, and we're done. This is essentially what we just went through. We went through an instruction and then a completion step, which is one of these steps, right? And then we finish, right? After we finish our steps, we wrap it all on a task. So ResearchKit requires us that we wrap everything on a task. Think of a task as your piece of paper where each paragraph is a step, an instruction step or a question step, right? After we're done with our task, all we go ahead and do is show it and show these questions to the patient. CardinalKit lets you focus on the content of your survey, knowing that the results of what your patients type will be streamed to Firestore right after your patient finishes in real time, right? So you might be wondering, what kinds of steps do I actually have available to me? If you were lucky enough to have tuned in earlier on our live stream and seen the Apple team give their breakdown of ResearchKit, they gave a couple examples of what the different steps are. If you're able to join, don't worry. The ResearchKit project, if you download the ResearchKit project on GitHub, there is an ORCID catalog app that you can run. So actually, here's the ResearchKit project. All I did is I downloaded the code on GitHub and I opened it with Xcode. It comes bundled with a couple samples and tests that you can run, even one for your Apple Watch. The catalog can serve as a fantastic source of inspiration. If you do go ahead and open it, you will see that it has a couple of steps that you can use to really bring your app projects to fruition. So let's see. So let me start at the top. A couple examples are that maybe you want to ask your patients a yes or no question, and here's the step that you can use to do that along with the source code, right? Maybe you want to ask your patients to select an image. I think the Apple team could have been a little bit more creative here to put a circle in a black square, but this could be an image, a picture, or you could technically recreate a CAPTCHA. Not that you want to do something that evil, but you get the idea. You might want to ask your patients for a number, and you can do that through here. A numeric step. You might want to ask your patients for something else, like the time of day. You might want to ask them to take a picture of a wound that they had, and so that you can process it using Google's machine learning interfaces on GCP. Or you might want them to take a video so that you can do the same thing. You might want them to answer text. You might want to say, hey, give me one paragraph about your day, so that you can grab that text and run some kind of NLP analysis on it and come up with any kinds of interesting conclusions. And part of these steps is that you
well, first of all, here's actually the consent step that we just went through. It is part of ResearchKit. You know, no magic here, just an example of it running. And part of it is there's also the concept of an active task. So using ResearchKit, you could ask your patients to perform some kind of physical activity that includes a short walk. This is a 20-step short walk that includes a reaction time test as well. Any kind of there's a full comprehensive list of active tasks that you can leverage. A lot of these I don't even know what they do, but I find it interesting to use this as inspiration. You might know somebody that might benefit from some kind of application of an active task, and you might want to put something to the test. What you see here is your palette. So back to the questions. If I do have a question, please leverage the study task review controller for your source so that you can modify it and come up with your own questions, with your own content. One way by which you might do that is you might say, okay, after the instruction step, I actually want to go ahead and ask my patients if they've had some coffee, kind of mirroring the process that Varun showed earlier in the day. So what I'm going to do to enable that is I'm going to go ahead and ask a question step. When you do put this down, your identifier is how you will find this question on Firestore. So it is how you'll be identifying against certain responses. And this is how you know what to look for, right? So this is my coffee question. You can name this however. And coffee and question is, have you had any coffee today? And there you go. So you see the step here where you get to specify an answer. What kind of answer might you want? If you know, great. If you don't worry. You could potentially just type the format that you see there, or open source ResearchKit answer format dot, and you'll see a breakdown of the different options that your questions can query by. So here's a Boolean, because did I have coffee today? Yes or no, but I wish I did. Just a very quick answer type. I can actually go ahead and put that here. And lastly, it has to be part of the steps that I want to show with my task. So let me go ahead and add that copy step into the mix. And my task will automatically grab those steps and show them back to the patient. It is as simple as that to create additional surveys and to add them to your projects. You might see a couple of examples up here in the study task Swift.file that trigger some of the active tasks. So here's, for example, here's a short walk. If you don't have access to the ORCID catalog app for any reason, you could type in the ORCID, the open source ResearchKit order task, and just type in a period and see a full list of a lot of the active tasks that you can use. Fitness check, whole peg test, knee range of motion task, reaction time, speech recognition, spatial span memory. There's a lot of possibilities here for you to look into and look through. Here's just an example of the short walk. For our coffee question, if I did have the right task here, it should be the second thing on the list. Here you go. Have you had any coffee today? Yes or no? And that should be finalized by thank you. We appreciate your time. That's it. Done. Document successfully written. They didn't really have to do anything. It's already up there on your database. For all of you hackers out there, there is a study table view controller plus CardinalKit file. If you click on it, it will show you some of the code that is used to actually stream information over to Firestore. It is customizable. And one thing to keep in mind is that what CardinalKit is careful about is that it gives you a pattern to follow by which you could leverage a lot of these services in a secure way, right? And this might be make a little bit more sense if you heard Alex's talk earlier and you heard a little bit about rule sets and why rule sets are important, right? CardinalKit stores things in a way that lets you define rule sets against them. It is by all means not the only solution that does this, but if you have no background on the topic, we hope that this is a powerful entry point to get you to create your apps a lot quicker without having to worry about nuance. Now, before I continue, does anybody have any questions regarding ResearchKit or any of the content we've just gone through?
I don't see any questions in the chat either, Santi.
Awesome. Okay. So we can wrap up with a really important high-level concept, which is that the entire app that you've seen is a ResearchKit powered powerhouse. Everything from the consent process at the very beginning of the app to the surveys that we just showed and let you edit and go through. So if you take a look at the onboarding view controller.swift file, you might see something very familiar, which is that once again, we have a task. And for a task, we have a bunch of steps. So what did we go through when we started our app and when we actually clicked through the consent and onboarding process? We went through a consent process. We reviewed the consent and signed it. We logged in. We verified our email. We entered a passcode. We asked for health information. And then we congratulated the patient for completing it. These are the steps that we chose to onboard patients into CardinalKit. You can change this and fully customize this to whatever you want using the palette provided by ResearchKit. Part of your onboarding process might be to ask a couple of questions about whether or not your patients had coffee, or it might be to make them walk a little bit. Make them have a short walk of 20 steps. That might be part of what you want to do in your applications in order to have your patients get started. If for that reason, well, the onboarding view controller.swift file is a great starting point. If you see something here like the passcode step controller, or if you recall from our sample, we did ask patients to enter a passcode as they were logging in. If you don't want that, you can just remove that step, and it's no longer part of your onboarding process. Replace it with something else. The HealthKit data collection, if you don't want to collect any HealthKit information, you can just remove that step, and then we can move forward. You can replace that with something else. If you're having any issues logging in, I don't know why you might want to remove the login, since it would disconnect you from Firestore. But at the very least, you could move things around and find something that works for you. So hopefully this gives a little bit of background as to how you can customize your entire apps, ask the questions that you want to ask, and do so in a quick and swift way using just CardinalKit. This framework is extremely extensible. There is a lot packed into here that has yet to be unlocked for the research community as a whole. And yeah, truly excited to be sharing this with everybody and excited to see what you guys come up with. A last reference is that Varun did go through some of the issues on our GitHub repository. There are a lot of feature requests here. If any of these are of any inspiration, please come by our office hours and or post on Discord, and we can give you some more context as to how to develop against some of these things, and how to try and how to get an app up and running based on your requirements and prerequisites or goals or what you're hoping to accomplish. So on that note, I will stop there and kind of leave the room open for questions. And I'll also take this opportunity to check on Discord to see if anything has come in through there. So stay tuned. If anybody has any questions, now's a great time. I believe this just about wraps up our main programming for Friday. Brandon, let me know if I'm missing anything or if that was not the case. Either way, we will be available through the rest of the day, through all of tomorrow and all of Friday through Discord to answer any additional questions and guide teams.
Yeah, terrific. Thanks, Santi. At this point, we're going to probably give it, say, 5 to 10 minutes and then move into office hours. Both we have prior biodesign fellows as well as some biodesign faculty standing by who are there and willing to help with people's need statements. And then we also have some members from the CardinalKit team available to provide some technical support and really kind of continue what Santi's been laying out here. And all that information is available on Discord. Yeah, so do we not have the instructions on there for queue status? But we'll get the instructions posted if they're not already there. But the long and short of it is that we'll be using what's called queue status. And it's essentially a queue management system and waiting room. You'll go into queue status and then we'll let kind of people in and go through the queue one at a time. Amir, do you want to provide, or is there anything else we should comment about that?
Can I quickly jump in about queue status? So there's a channel in Discord called FAQ, and one of our team members has posted a PDF here called Virtual Buildathon Talks and OH for office hours information. You'll find the detailed rundown on how to get to queue status and how we're going to use it for office hours in that document. So head over to the channel FAQ on Discord and you'll find detailed information.
Perfect. Thank you, Anthea.
Great job, everyone. I guess that's it, right? It's almost 6:30, not quite yet. But I think you did everybody did a fantastic job and super exciting. We're looking forward to hearing from everyone and seeing the projects that get built. So have a great evening and we'll see you, guess we'll see you during office hours, and if not then we'll check in tomorrow morning. Thanks, everyone. Are we going to sign out? Maybe sign out to some music? All right.